The SDGs are essentially a good framework for us to think about what we need to do in health, and having thought about it, for us to carry out different interventions and initiatives in relation to health. Now, SDG number 3 really basically talks about promoting health through all aspects of the life course, and that orients our minds to some of the particular challenges that we might face at different stages of that life course. I mean, starting from matters to do with child mortality and the transmission of HIV, AIDS, and congenital syphilis, and we, over the past couple of years, have been able to get a handle on some of those things. And moving from there to the other extreme of matters to do with non-communicable diseases, which are essentially problems of the age, the older segments of our population. So it gives us the sense that we have to be looking at a broad range of things and seeing how we could best address these in a collective, collaborative, even international way, these problems. And, apart from those two, we grapple with the communicable diseases. We grapple with the Zika virus, which is running riot in our part of the world right now. I hope that we could subdue it and bring it under full control to the extent possible as soon as we are able, because we do not want there to be, we want to minimize the harm that these sort of threats could pose to our way of life and the risk that they put to our health security. Well, we've made some commendable achievement, I think, in terms of the initial agenda related to the Millennium Development Goals, and that is spinning off into the progress on the front of the Sustainable Development Goals. For instance, we've been able to bring into submission the matter of the mother-to-child transmission of HIV virus and congenital syphilis. In fact, we have eliminated it subject to final validation. And this puts us, as I said in my speech earlier, in the esteemed company of the Republic of Cuba, who is, as far as I'm concerned, a healthcare superpower within the region of the Americas. So that is a considerable achievement. In terms of maternal mortality, we've been able to also make considerable progress on that front. In fact, maternal mortality in our country is statistically zero. In terms of neonatal mortality and child mortality more generally, we have done well by that score also. So we've experienced a lot of progress on the Millennium Development Goal agenda, and we look forward to similar progress in relation to the SDG agenda. Well, first of all, we need international cooperation. One of the things that we should highlight, coming from small countries like our own, at any forum basically, is that we have to work together to achieve these things. And we have to begin to see the people who live in St. Vincent and the Grenadines as not being simply Vincentians, but being a Vincentian component of the world population. This is a world population that we are essentially dealing with. So I want us to take an international approach of solidarity to the matter. I would like to see World Health Organization experience and expertise coming to bear on the problems that we face, coming to bear on our mission to transform the world. I think that POW has been doing a good job with our country over the years, and we want to strengthen that even further. We appeal to nations to come to our aid and to help us. It's not as if we are just sitting idly by and asking them to work miracles on our behalf. We are doing our part and asking them in the spirit of a common humanity to come to our aid and help our cause. Well, within this assembly, the main topic would have to be about the non-communicable diseases and how we tackle non-communicable diseases. The point was made, when we had World Health Day the other day, the theme was around diabetes. And this is something that touches home to me. I have a grandfather who died from diabetes. I have a grandmother who died with diabetes. So this is not an abstract problem. This is not something I hear about without feeling its effect and it meaning something to me directly. Now, if that has affected me in that way, and that is my story, the same is really true of so many other people in the Americas, so many other people in St. Vincent, so many people in the Caribbean, so many people in Latin America, and in the Americas in general, even North America. So that is a vexing issue that I feel I have a personal interest in addressing. So non-communicable diseases, more broadly speaking, not just restricted to diabetes, is something of an important element that we want to tackle with full force. We've established a non-communicable diseases commission, and we're going to go at it with all we have. Quite apart from that, there is the overarching principle in so much of what we do about universal access to quality health care. We are committed to that. We are setting up health insurance programs and systems to take care of vulnerable people, and we're going to make sure that the quality of life in St. Vincent, and to the extent that we're able to influence it, the quality of life in our region is better off for my representation in the Ministry of Health. Well, what we're doing right now is carrying out a renewal of primary health care in St. Vincent, and I think that we need to focus essentially more and more, as we have begun to do, and we're doing it with a greater competence, on how we could prevent people getting sick in the first place. And we could do this through setting up a system of regional or local health centers in different areas, but we can't just ask people to come to the clinic. Sometimes the clinic has to go to them. We have to have health groups which organize different activities and events at the local level so that the message of health reaches people. When we're talking about Zika, we don't just sit down in our offices, for instance, and go on television or on radio and say, we have a message about Zika. We organize community meetings, we bring the people together, we tell them about the consequences, we say to them, look, you need to do X, Y, and Z in order to prevent a healthcare catastrophe, and that has best results. I commend it to the entire world.